Hey guys, it's the Med Studier and today we'll be having a look at hyperkalemia. This is a very common exam question and something you'll be expected to manage as a doctor. Specifically, we'll be having a look at the causes, presentation, management, and much more. So, what is hyperkalemia? This is when there is a high amount of potassium in the blood. It's essential to pick this up early on as it can cause cardiac arrhythmias leading to potential patient death. Some of the causes of hyperkalemia include pathologies like AKI, CKD, rhabdomyolysis, tumor lysis syndrome, and adrenal insufficiency. Certain medications like aldosterone antagonists, ACE inhibitors, angiotensin receptor blockers, and NSAIDs can also cause hyperkalemia. So, how would you investigate this patient if you had them in an exam question, in an OSCE, or even real life? Urea and electrolytes. Hyperkalemia is formally diagnosed by taking a U&E blood test. If you suspect that someone has extremely high potassium, make sure to also have a look at their eGFR, urea and creatinine, in order to assess their kidney function, as the patient may need hemodialysis. Additionally, as mentioned earlier, what's going to damage the patient the most is the effect of potassium on their heart. Once you've done their bloods, you'll need to do an ECG for all patients with a potassium level of above 6 millimoles per litre. On an ECG, the high potassium has characteristic changes. This includes tall, peaked, or tented T waves, flattening or no P waves, and a broad QRS. This is a common exam question, so it's definitely worth remembering. And you can remember this using the push-pull effect as shown here. In hyperkalemia, the T waves are pulled up, almost pulling the rest of the ECG along, and therefore broadening the QRS and flattening the P wave. Now that you've identified that this patient has hyperkalemia, how do we manage them? This can depend on the level of potassium in their blood. For a potassium level of less than 6 or equal to 6, an otherwise stable patient, there is no need for urgent treatment. They may just require a change in their medications, such as stopping the ACE inhibitors. In patients with potassium levels of over 6 and ECG changes, or those with potassium of over 6.5 regardless of ECG changes, need urgent intervention. Calcium gluconate is used as it stabilizes the myocytes of the heart and hence reducing the chance of the patient experiencing an arrhythmia. Hence, it's often the first choice of management. Insulin with dextrose infusion helps to move carbohydrates into the cells during this. The potassium is then taken into the cell and therefore reducing the amount of potassium in the blood itself. The insulin used here is Act Rapid, 10 units, and dextrose to 50 ml of 50%. Nebulized salbutamol acts in a similar way. Oral calcium resinum removes potassium from the gut and into the stool, and hence removes potassium from the body altogether, but this can take slightly longer, so it's reserved for milder cases. And that brings us to the end of this video. Hope you guys found it useful. Please remember to like, share and subscribe, and follow me on Instagram at the Med Studier.